I am Dr. Jaideep Tang from Mumbai, India. I am the Secretary General of FOXI, that's the Federation of Obstetrics and Gynecological Societies of India. In India, the government as well as the private sector are both fully committed to achieving universal health coverage. A significant proportion of care is delivered by local private providers. Over 50% of all women in India seek maternal health and family planning services from private providers in India. The role of the private sector in offering high quality, safe, and respectful SRH services to women and adolescents is self evident, and given the size of the population it caters to, extremely important and significant. Even during the pandemic and through the lockdown, several providers in the private sector, like me, continued to provide services to patients. The COVID-19 pandemic has shown us that multi-stakeholder response and the force multiplier effect of these synergies is crucial. Public-private partnerships represent a critical component in filling the gaps, both of human resource and infrastructure, that exist in modern-day healthcare. FOXI, a professional association in India, is already leading the way via an initiative to implement and assess WHO evidence-based standards of maternity care across the private sector through our initiatives, Manyata, and a Government of Maharashtra FOXI-supported initiative, Laksh Manyata. There is an urgent need to bridge the trust deficit and look beyond monetary incentives to increase private sector involvement. The government, for example, can consider developing incentives to encourage private participation under a unified and resilient health system, where both sectors compete on equal terms under a framework that regulates each fairly. For example, transparency in administrative processes, reducing the steps for compliance, and reasonable laws and policies that are not skewed towards any one side and not treating every adverse outcome as medical negligence could increase the private sector's incentive to participate. An example could be a single window system for regulatory compliance. This will not only incentivize the private sector, but will also be cost effective for the government. It is vital that the government as well as the public at large recognizes that healthcare providers also need to be safe and shielded from abuse. Moving forward, a thorough mechanism that revolves around fair incentivization and equally important recognition must be embedded within the current PPP framework for SRH services. Our government understands this and has also shown interest in engaging more with the private sector in a recent WHO Government of India Partners Country meeting. I believe that this is recognition of the fact that sustainable and long-term partnerships in general, and PPP models in particular, require a level playing field and the creation of win-win outcome for all the partners.